Hello, my name is Amanda Basher, and I am one of the Joint Replacement Program Coordinators for Henry Ford Health System. It is important to get your body ready for joint replacement surgery, and doing these exercises will help you recover faster. Today, Chris will show you exercises to do before and after surgery. Jennifer will show you more advanced exercises that your physical therapist will tell you when to start after surgery. Remember, these exercises should not cause more pain. They may be uncomfortable or hard to do at first, but stick with them and it will get better. It is important to go to all of your therapy sessions and always follow the directions your physical therapist gives you. You can find all of these exercises in your Joint Replacement and Recovery Patient Education Guidebook, starting on page 12 for the first set of exercises. I'll turn it over to Chris to go through the first set of exercises with you. Remember to do these exercises before surgery and right after surgery. You'll want to do each exercise 10 to 20 times, 2 to 3 times every day on both your surgical and non-surgical leg, unless your doctor tells you something different. You can do these exercises on the bed or the couch. They do not need to be done on the floor.
So ankle pumps is first exercise. You want to start with your legs out straight, toes pointing up towards the ceiling. You're going to bring your toes, point them up towards the ceiling as much as you can, and then bring them back and then push them forward. It's like you're stepping on and off a gas pedal, just like that. Heel slide is the next exercise. You're going to start with your legs out straight. Then you're going to work on keeping your knee pointed up towards the ceiling and sliding your foot up toward your buttocks. Hold it there for about 5 seconds and then slowly lower it back down to the starting position. So again, knee pointed up towards the ceiling, slide your foot up towards your buttocks, hold it for a couple seconds, and then slowly lower it back down to the starting position. Okay, so the next exercise I'm going to show you is a quadricep set, and we're going to be tightening this muscle in the front part of your thigh, the quadriceps muscle. You're going to do that with the leg out straight, leg relaxed. Tighten this muscle by pressing the back of your knee down into the bed. Hold it down tight for 5 seconds, and then relax. So we're pressing down, holding tight for 5 seconds, and then relax. All right, the next exercise I'm going to show you is the straight leg raise. So the starting position is one leg bent, one leg straight out in front. The exercise is you're going to lift the leg that's up straight up off the bed. You're going to lift it up slowly, about 12 inches off the bed, hold it up for about 5 seconds, and then slowly lower it back down to the starting position. So again, one leg bent, the leg that's out straight, that's the one you're going to lift up off the bed. Keep the knee straight, lift it up about 12 inches, hold it up for about 5 seconds, and then slowly lower it back down to the starting position. Next exercise I'm going to show you is called a gluteal set. So you start with your legs out straight, and the exercise is you're squeezing your buttock muscles, squeezing them tight together for 5 seconds, and then relax. So again, you're squeezing your bottom muscles, squeeze, and relax. Now the next exercise I'm going to show you is hip abduction. Starting position, on your back, legs out straight. You want to make sure when you're doing this, you're keeping the knees straight and the toes pointing up towards the ceiling. The exercise is sliding your leg out to the side, then slowly coming back in, making sure you're not crossing your knees while you're doing this exercise. The next exercise is bridging. Now with this one, you're going to start on your back, knees bent. The actual exercise is you're going to push your heels into the bed and you're going to work on tightening your buttocks and lifting them up off the bed. Short out quad is the next exercise I'm going to show you. So you want to roll up a towel, place it underneath the back of your leg here. You're going to keep the back of your knee against the towel roll while you're doing the exercise. So you'll lie back down. The exercise is you're trying to straighten out that leg. So you do that by picking your foot up off the bed, holding it up for about 4 or 5 seconds, slowly lowering it back down to the starting position. So now we switch to doing some exercises in the chair. So this first one I'm going to show you is called long arc quad. You want to start with your knees bent, both feet flat on the floor. The exercise is kicking that leg out straight, holding the leg out straight for about 5 seconds, slowly lowering it back down to the starting position. So again, kicking the leg out straight, holding it out for about 5 seconds, slowly lowering it back down to the starting position. Chair push-ups is the next exercise I'm going to show you. You want to start in a chair. Straight back chair with arms is typically best. You want to make sure that your bottom is slid a little bit close to the edge of the chair. The exercise is you start with your feet flat on the floor, pushing down on your hands on the arm of the chair. You push up till your elbows are straight. Hold it up for about 5 seconds. Slowly lower yourself back down to the starting position. So again, you'll push down on your hands, lift your bottom up off the chair, elbows straight, 5-second hold, slowly come back down to the starting position.